Good afternoon. I'm Senator Bernie Sanders, and welcome to a Vermont town meeting. Let me begin by introducing Jennifer Henry. Jen has been a registered nurse for 21 years.
How many of you here have yourself or know people who have put off health care because they were afraid that it would cost too much? Raise your hand. All right, quite a few people are raising their hands. And I've been fortunate enough to have good jobs with good health insurance, and I've been paying into those, paying my premiums and paying my co-pays. And now that money that I paid in all those years is being used to create ads and things that you're reading in the paper that aren't true about our current healthcare system. And it's about time that we as people thought about the fact that this is a moral issue. What's happening to the people in this country, the people who don't have millions of dollars to spend on newspaper and TV ads, they're suffering, having pain, and even dying.
Right now we're in the midst of a major recession. We have 9.5% of our workforce is unemployed. One of those unemployed workers is an iron worker from northern Vermont, Dave Kaczynski. And Dave, why don't you say a few words about your perspective as an unemployed iron worker?
Thanks. Hi everybody, my name's Dave Kaczynski. I'm a 21-year iron worker. I'm a single dad. I'm a 20-plus year Vermont resident, and I'm also an insulin-dependent diabetic. The last job I was on, our health care cost was $7.20 an hour out of our package. That's what it costs for us to have health care. And again, the last job I was on was 2 hours and 15 minutes from my house in Leominster, New Hampshire. I was happy to be putting up a beautiful windmill project down there, and that was the last full-time job that I had. When I lost my health care, my diabetic supplies, if I had to buy them in the store, are $800 a month. I applied for VHAP, and I want to say I gratefully got it. And I got to say, it's I'm not the kind of person who likes to ask for help that way. I'm really not. I've been a proud blue-collar guy for a long time. I come from a lot of generations of blue-collar in my family, and it was a tough, but I don't have a choice about the diabetes, so I did what I needed to do.
Millions of Americans have lost their homes. They have lost their savings as the stock market plummeted. They have lost their hope and their ability to send their kids to college, put away money in the bank for years. That money disappeared. And millions of people like Dave Kaczynski have lost their job. They say officially that unemployment is 9.5%. In reality, it is a lot higher than that, because a lot of people have given up looking for work. In terms of health care, we have a situation that has to be dealt with. Not just because 46 million are uninsured. Not just because even more than that number are underinsured, including many of you, with high deductibles and high co-payments. It's not just that 60 million people in our country do not have access to a doctor on a regular basis, and according to the Institute of Medicine, over 18,000 die every single year because by the time they get to the doctor, Jen related that story, it is too late. In this year alone, 1 million Americans are going to go bankrupt because of medically related bills. Small businesses are spending far more than they are able to spend to provide health care for their workers rather than reinvesting in their business and creating jobs. If present trends continue according to all of the studies, your health care costs are going to double in the next 8 years. So if you're paying for your family now $12,000 a year, you'll be paying $24,000 a year. Millions of people will be paying 50% of their income on health care. That is unsustainable. It can't happen. The country can't survive when we're spending that much more on health care. When you look at that photograph, you say, is this the United States of America, or is this a third world country? We should not be treating people that way. Now, some of you may say, well, maybe that's California, it's not Vermont. Let me talk to you a little bit, just a report that I received yesterday. Because a doctor, she did a survey of her patients, the people she treats. This is what she discovered. 34% of her patients reported not taking their medicine or taking less than they should, cutting their dosages in half because of the cost of drugs. And by the way, these are people who were able to walk into her door. 25% reported that they borrowed money for prescription drugs, and 20% reported that they had trouble paying for food or rent in order to pay for their prescription. You cannot believe the power of the lobbyists and the special interest in Washington. According to the Washington Post, the healthcare industry is currently spending $1.3 million a day, making sure that we do not pass significant healthcare reform.
People call me Carr. My name is Carlin Ann Johnson Ackerman. As far as the lobby money goes, George Soros has poured $5 million into advertising for the program. And I believe the acronym is PRHMA, the American, and it has to do with the AMA and the pharmaceutical companies, have at this point poured $12 million into a program for this health care reform. I grant you we need some type of reform, but we do not, I don't understand why we need a system for everyone when the Vice President's task force report has a certain type and class of people that need this. I have difficulty understanding why we need it and why we have to rush.
How many people here believe that health care is a human right and should be available to all people? Raise your hand. Okay. How many people do not believe that all Americans should have health coverage? And should the government make sure that every American has access to health care? Who wants to? Okay. All right. In my view, I think the majority of the people here feel that. Not everybody.
My name is Doris McFarland. I do not belong to any organization, nor I belong to a mob. I'm here speaking to you from my heart. I will go along with your health plan. If you can promise us that you and your family will enroll in this plan. And if not, can we enroll in your people's plan? Thank you.
Excellent question. The answer is absolutely yes. Absolutely. Let me tell you a story. I have the same health care as a member of the Senate that every other federal employee has, that my secretary has, that the postal workers have. And you know what? It's a good plan. It ain't a great plan.
I'm a nurse. I work in Bennington for an internist primary care physician. I just need to make this clear, and I'm probably going to be getting booze for this, but people really need to know that physicians, especially primary care physicians, get paid very little money. Very little money. I can tell you for a fact that 60% of our patients are Medicare patients, and for a blood draw, he gets paid $2.50 for what I do. Okay? Sometimes it takes a long time to get that blood. He could not be here today, and so he asked me to relay this to you. Please tell him for me that getting insurance for everyone won't matter without payment reform that encourages good primary care and prevention and stops rewarding, encouraging only volume and procedures.
If you are a young person graduating medical school right now, on average you're $150,000 in debt. You don't go into primary health care because you've got to make a lot more money than that to take care of your family and pay off your debt. What we are going to do is increase by 10 times the amount of money so that when a doctor goes into primary health care, into an underserved area, that young person will have his or her debt repaid over a 5-year period. My goal, and I've been working on this for 6 years, is to make sure that every person in this state, regardless of income, who needs to see a doctor will be able to do so. This is what we've accomplished in 6 years. There is a program called the FQHC, Federally Qualified Health Care Program. One of the least known and one of the best public health programs in the United States of America. 6 years ago there were 2. Now there are 8, including one that starts up in Rutland. What do these programs do? You can, with a federally qualified health care program that receives some federal funding, you walk in the door. If you're on Medicare, great. If you're on Medicaid, great. If you have private insurance, great. If you have no health insurance, a sliding scale to make it affordable to you.
If health care should be provided to all, and you are concerned about the most vulnerable in our society, will you vote for legislation to protect vulnerable children, especially those in the womb, as well as all life? Being 62 years old and having a husband who's about to go on Medicare, I'm wondering, what are your thoughts about those that are, by some who are appointed by the president, considered as non-contributing to society, that we will be protected till our natural death? Thank you.
First of all, Lynn, I'm delighted that you're here. And it is always been, as I mentioned earlier, we've had hundreds of town meetings, and I want everybody to feel comfortable. We are friends, we have disagreements, and that's fine. Let me just answer a couple of your questions. As you probably know, I am pro-choice. That's my view, has always been my view. I think the government should not be telling women what they do with their bodies. But having said that is my view, that's no secret, everybody knows that. But Lynn, in terms of this legislation, there is a bill that you may be familiar with. It's called the so-called Hyde Amendment. And that means that federal funds may not be used for abortion. That provision remains intact and is the law of the land at this moment. Okay?
I could not afford to pay out of pocket for a mammogram. The following year I did go because I did have some health care coverage, ended up being diagnosed as a stage 3B breast cancer. After I could no longer work and had no paycheck, I was told, if you want to pay $252 every 2 weeks, then we will continue to keep you on our Blue Cross and Blue Shield plan. My husband is severely disabled from a car accident, and what he gets for Social Security pays our mortgage. My check covered my insurance and everything else. So to cover my chemo and to pay for my radiation, we used our savings, all of my retirement fund, we sold our plow truck, our boat, everything we had worked for so I could continue to have medical coverage. So for those of you who don't feel that health care is a human right, I ask you, do you feel that it's a human right to die because you can't afford insurance?
Hi, Senator. My name is Michael Gardner. I'm in a fairly unique position. I'm one of
Mike, where are you from?
I actually live in Shasbury, born and raised.
Okay.
And I'm in a unique position relative to everyone else in this room. My generation is going to be paying back all of the debt that we're accruing right now. So far this year, I'm paying other people's mortgages, their insurance, and giving them $4,500 to buy a new car. While myself, I have maintained a very strict fiscal discipline. Could you please explain to me why we don't talk more about individual responsibility, individual reform, and stop bailing out people? Now, I understand the medical issue, and I'm not talking about healthcare, but stop bailing out people that take on unnecessary debt and leverage and get themselves in trouble. Why don't you talk more about that?
This country has an $11 trillion national debt. That is a huge debt, and you're right. It's not only your generation, it's my kids and my grandchildren are going to have to pay that off. Here's the dilemma that we have, Mike, and honest people can disagree. Under Bush, as you know, the national debt went up pretty high, primarily because of the war in Iraq and tax breaks to the wealthy. Obama comes into office. Here's the dilemma that he and I and others are faced with. Here's the dilemma. This country, according to some very, very knowledgeable people, is on the verge of a financial collapse which could lead to a world depression and you not having your job. What the best economists in the world agree to, not all of them, is that if you don't create stimulus, if the government does not in fact start putting money into things like a stimulus project, so we're putting people to work, building our roads, continuing to work in schools, in police departments, that if you don't do that, there is a chance, a reasonable chance, we sink into a depression which could go on for 10 years.
I predict future happiness for Americans if they can prevent the government from wasting the labors of the people under the pretense of taking care of them. Thomas Jefferson, Dwight D. Eisenhower, who said, a people that values its privileges, and I hear a lot of people with wants here, above its principles soon loses both. I praise God for people here who stand on principle and not depend on government, but depend on the freedom of American people to make life good for themselves and their community. God bless America.
How many people think that we should not abolish Medicare? My point is, one of the funny things that happens when you're in the Senate is you meet a lot of people. And people come up to you and they say, get the government out of my Medicare. Medicare is a single-payer government health care system. That's what it is. In the House of Representatives, there are 3 separate committees dealing with health care. Each one has their own plan. In the Senate, there are 2 committees dealing with health care. One has passed something, one is still negotiating. They haven't done anything yet. When the 3 committees in the House merge their plan into one, and the 2 in the Senate merge theirs into one, they'll be voted on in the House and the Senate. If in the Senate we sustain 60-vote filibuster from the Republicans, then you go to conference committee and the president weighs in and you end up with a health care plan. So if people say, well, this is the health care plan, the answer is there is no health care plan. And that's one of the pieces of confusion that's out there.
I was told 9 years ago I had a 3-inch tumor in my right thigh bone. I went to 3 doctors who told me I was going to die if I didn't have it taken out because it was bone cancer. And 3 said, no, it's a benign tumor, you're fine. Well, who do you listen to? My ex-insurance company said that the test I needed to determine what I had was medically unnecessary. And I fought for 6 months to get my testing approved and was able to have it done. It's still inconclusive, but 9 years later, I'm still on both legs. So I'm going with the guys who are on the lighter side of life.
This is an underserved area, and I run a rural health clinic in this community. My opinions are that we have the best health care in the system, and we also have the worst health care in the system, in the world, I should say. And I think the insurance companies are not motivated to provide better health and better services. Their motivation is to their bottom line. So they create administrative difficulties for the providers, they have administrative difficulties for the patients, they change medications, they change rules, they make it hard to get through to them. They don't have a motivation. I think the public option provides competition to allow them to hopefully compete on services.
Do you find in your practice the people are walking into your office sicker than they should be?
If they have no insurance or are underinsured, there's no question about it. They don't. If they take medications, they don't take it properly. They don't come in for routine health care. They don't come in for dental care.
And in the long run, that ends up costing the system more money, doesn't it?
Exactly.
I have no faith that the government will be able to manage that when I see that they have not managed my Social Security, they have not managed my Medicare, they have not even managed the post office. And I cannot expect, and I don't believe that the government will be able to manage this.
Prescription drug program of Medicare. It was essentially written by the insurance companies and the drug companies. What it does right now is it covers, roughly speaking, and maybe off a little bit here, about the first $2,300 or something, Medicare will pay for that. Then there's a so-called donut hole where the recipient, the beneficiary, has to pay 100% of the cost until it gets to about $5,500, roughly speaking. What we want to do, and I am determined to do, is to fill that donut hole, because a lot of the people in the middle are paying 100% of their prescription drug costs, which are really, really hurting a lot of seniors. Because of the power of the drug companies and their lobbying force, their campaign contributions, our people end up paying by far the highest prices in the world for prescription drugs. And it's not just Canada, it's Europe, it's Asia, it's every place. So we're going to work very, very hard in a number of ways to take on the drug companies and lower drug prices in this country so that people are not misled.
My
my major concern with healthcare is not that people will not get covered by insurance or have healthcare. I think we can work out something that is not government run and a single payer system. Universal healthcare is not going to work.
The idea that there are so-called death panels that will deny coverage to children who have Down syndrome is totally insane. Tom, it doesn't exist. It never will exist. Believe it.
Senator Sanders, Diana Meehan from Arlington, Vermont. Are there aspects of our system which are really the best in the world that we would want to be sure we kept?
I think there is. I think there are some things, I think it's absolutely true. You have sheiks from the Middle East coming here to get cutting-edge surgery and cutting-edge drugs and so forth. That's absolutely true, and we want to maintain that. So there are some things that we do in the system. We have, some fantastic physicians who are the envy of the world. On the other hand, our weakness is that we are the only nation in the industrialized world that does not guarantee health care to all of its people. We're very weak in primary health care, as I think we have talked about here. Many people don't have access to a doctor or a dentist on a regular basis. I think we do not do a good job in disease prevention. We spend a fortune on chronic diseases like heart disease, cancer, diabetes, but we spend a tiny, tiny fraction of that trying to prevent people from coming down with those diseases. We've got to do better than that.
Why have all the members of Congress and the Senate exempted themselves from being mandated to change from their self-appointed to death to we part healthcare system while we're having it literally shoved down our throats? And again, I thank you again for coming.
Okay, the last point, I know the last point is a talking point that gets out. Let me talk about the last one. The public option is an option. And what was suggested is that Congress, members of Congress, have got to take that plan. But that's diametrically opposed to the whole principle of what we're trying to do. What we are trying to do with the public option is give you and me a choice. So you have Blue Cross Blue Shield, you have another private insurance company, and you have a public option. You look at them, you say, you know what? The private insurance company works best for me, I'm taking it. Or you may say, you know what? I like the price of the public option, I'm going to take that. The point of the public option is to keep the private insurance companies honest, so that they can't just raise their rates off the wall and then tell people that's the way it is. Nobody, not any member of Congress, not you, not anybody here, is going to be forced to take the public option. It is an option.
For most hardworking Vermonters, the idea of a free ride, we resent. But as somebody without health insurance, I'm not asking for a free ride. I'm just asking for an affordable ride.
I'm Lydia Roberson from Shasberry, Vermont. And there are a lot of people talking about universal health care and how we all want it, but to me, government and bureaucrats are writing it, and that's what I have a problem with. Specifically with the bill, the H.R. 3200 that's in front of Congress. Have you read the entire thing?
No, because I'm not in the House.
Okay, well, it's getting ready to come to you, so be familiar with it, please. Because on page 30, section 123, it says there's going to be a government committee that decides what treatments will benefit me and other people. On page 354 of that bill, line 1177, the government will restrict the enrollment of special needs people. There are a lot of people that need that bill, so you're going to restrict it and restrict it.
No.
I got more. You can answer it in a minute.
Okay.
My turn. Page 430, lines 11 through 15, the government will decide what level of treatment you will have at the end of your life. It is in that bill.
No, you read it. No, it's not in that bill.
Okay, I can bring it to you afterwards.
No, you bring it to me after. That is
Okay.
not in that bill.
Okay, page...
Sarah Palin notwithstanding, that is not in that bill.
All right, I'll knock off of Sarah Palin. Look at page 430 of that bill when you get it, Senator.
What you're looking at is something that is complicated. It is 1,000 pages, and it is subject to misinterpretation. When I hear, and let me just say this on a personal note, I know Barack Obama. Some of you like him, some of you don't. But to think for a moment that this president would deny health care or kill off senior citizens is insulting and it is outrageous. No, it's not funny. It really is not. It's not something that we should be even talking about anymore. We can disagree, but let's not suggest that, or that people, kids with disabilities are not going to get health care. That is...
Why is it in writing, Bernie?
It's not in writing. That is absolutely not true. I think we proved this afternoon something that makes us all very proud, is that we live in a state where people can have different points of view, and yet we can listen to each other and we can treat each other with respect. Grassroots democracy and town meetings thrive in the state of Vermont. Thank you all very much.